Chatting away. Good evening, everyone. Welcome to another episode of the Functional Solutions podcast. My name is Dr. Sarah Ellis. I'm so glad to be joined by my wonderful co host, Dr. Tall. How are you today?
Doing well, thank you. We got a sunny day in Oregon, so I can't complain of sunny days in Oregon in April. So that's
Truly, right?
yeah.
Is April like the rainy season?
Yes, it's
Or is it
all
like,
year rainy season up to probably July.
really?
Yep. And then typically it starts back in we get a little summer and gets back in October, but I don't know, maybe it's global warming and things are shifting.
Yeah.
We've been having sunny, dry days more and more. So
Oh,
that's a pretty, yeah, I like it. So no complaints.
exactly. A little different from the norm.
Yes.
Exactly. Don't complain. That's good. Yeah, we're actually going to get some storms tonight. So it was kind of cloudy today, but a beautiful spring day nonetheless.
Wonderful. So
Yeah.
looking forward to today's discussion. We got
Yeah.
we got an amazing topic, which is probiotics for autoimmune conditions.
That's right. It's one of my favorite topics. I mean, I like to talk about gut health anytime. But there's been a unique, very kind of robust set of data that talks about the benefits of using probiotics in autoimmune disease or supporting patients with autoimmune disease by supporting their gut health. So tonight we are going to really kind of get into just two of the main kind of approaches or ways in which probiotics can help alleviate some of the symptoms or root causes of autoimmune disease. So, tonight we're going to go through and answer a couple of questions that you might have. Are there a difference in certain strains of bacteria? What has the research shown in terms of their ability to support patients with immune system dysregulation? And then we're going to talk also about inflammation and its role and how probiotics can mitigate that. So let's talk a little bit about why we chose this topic. I want to pull up an image from the Autoimmunity Journal. And this is so interesting because I love how it shows the way it's depicting the number of Americans that live with autoimmune disease. So if we look at this image, these numbers are in millions. So the autoimmune condition that affects the most people is lupus or systemic erythematous, lupus erythematous. So it affects 1.5 million Americans. The next most common is Crohn's disease and colitis, followed by rheumatoid arthritis, type 1 diabetes, and multiple sclerosis. At the end of the day, this study analyzed data from 2011 to 2022 and found that over 15 million Americans have been diagnosed with at least one autoimmune condition. And then one statistic that I found really interesting was that 34% of people who already have an autoimmune condition actually have more than one. And so this makes addressing autoimmune disease very important for those of us who are in functional medicine because the prevalence is notably higher in men versus women. So if we take a look at another image, this image shows the difference in gender, so the gender disparity. When we are thinking about addressing autoimmune disease, we also have to keep in mind the way hormones can impact it. And so when we look at which autoimmune diseases impact women more than men, we see that lupus is at the top. So it actually affects women 6 times more than men, so about 6-to-1 ratio. Next is adult rheumatoid arthritis, which is about a 3-to-1 ratio. Juvenile RA, 2-to-1. MS, also a 2-to-1 ratio. And then type 1 diabetes really is kind of 1-to-1 ratio or even 1-to-2. But what's interesting is Sjogren's disease is actually a 9-to-1 ratio, affecting more women than men. Now, we do have a couple of, or at least one autoimmune condition that tends to affect men more than women, just a little bit, which was psoriasis, 1 to 1.4. But this is such important data to consider when you are working up a new patient who's presenting to your office with autoimmune disease and you're trying to put a plan together. We do want to consider the fact that the prevalence is commonly higher in women. And research actually has found that the parts of the physiology that impact this gender disparity is the presence of two X chromosomes on or with females. And so there's growing body of research that addressing and looking into that gender disparity when it comes to autoimmune diseases. So, when we think about autoimmune disease and the management of autoimmune disease, Dr. Tall, let's chat a little bit about the role of functional medicine. So, what role do you think that functional medicine plays in supporting patients with autoimmune disease?
Yeah, so I'm so glad that we're talking about autoimmune conditions, because those patients, for any healthcare practitioner who is listening to this right now, they already know, having been in healthcare for probably about 20 years now in the field of healthcare, or a little bit more than 20 years. We Every healthcare practitioner know that working with an autoimmune patient is very challenging, right?
Yes.
It's challenging for the practitioner, right? It's really challenging for the patient, right? And many of those patients are just getting thrown a lot of different drugs, different types of drugs, and essentially we're constantly trying to shut down that flare up, right? That ongoing damage that is going on. That's really the mainstream approach, right? Is just to shut down, mask the symptom, try to
Right.
mitigate things as much as possible, right? And when we look at just asking ourselves, how are our patients doing with the, let's call it, the standard of care, right? There's different surveys, and one of them that I wanted to bring up is the survey that was done in the University of Georgia, the College of Public Health, and they took samples of individuals, and that was done a few years ago. They took samples of individual adults, chronic patients, right, that have at least one or more chronic conditions. And they found that 70% of the chronic patients they sampled were frustrated with the current standard of care or healthcare, right? And obviously, there's different reasons to that, but the number one reason, this is really interesting, and it's important for every healthcare practitioner to know. The number one reason for those chronic patients' frustration was keep going back to the provider and reporting the same, or complaining about the same exact symptoms. So we know that it's very challenging for practitioners because the patients keep struggling. If we've seen so many patients with rheumatoid arthritis, for example, they're on the drugs, they're on the steroids, they're on the biologics, yet years into it, right, their joints are so deformed that some of them, it's hard for them to hold a cup of water or tea anymore, right? So even in doing the most basic tasks, right, are very challenging for those patients, and they're very frustrated. So the functional approach is really where we kind of navigate and kind of move aside a little bit, or take 2 steps backwards. And instead of trying to just mask the symptoms, we're asking ourselves, what have triggered this condition, right? What have triggered this immune imbalance or immune dysregulation with the patient? And what are the current contributing factors, right? Because we already know that genetic plays a role, an important role, as you mentioned, but the science of epigenetic is teaching us that there has to be certain factors in our lives that trigger, right, the expression of those genes. And this explained to us why some patients have the genetic of a certain disease, but they don't get the disease, right? While others have a genetic predisposition and they do get the disease, right? So that's where we always have to weigh in what is, okay, we understand there's maybe a genetic component, but what's the epigenetic here? What's going on? What's triggering? This is exactly what we're going to talk today about, which is we're going to dive deeper into one of the major contributors to chronic disease, and how do we help our patients through using probiotics, right? So that's why I'm so glad that you brought it up. And it's really interesting because we know that those patients are going through a lot. They suffer a lot. They keep getting worse. And as healthcare practitioners, it's really hard to see that, right? So, so that's something that I wanted to mention, and it's really important. It's really important to talk about it, right? To mention that there is a different way to look at, get a deeper understanding of what it is that's causing those conditions, and what it is that we can do to kind of start reversing things around, right?
Exactly. Yeah. Autoimmune disease is kind of um it's a type of patient profile that I feel is like requires your whole toolbox, right? You're not going to just focus. I mean, as functional medicine practitioners, we don't just focus on one system or organ system in general. But in my experience, I found that it's definitely when you kind of have to pull out your go-tos, a couple of go-tos to support them because they have a lot of dysregulation going on. And we're going to talk about that later on tonight. But I loved what you said about that.
Yes.
Yeah.
So take us into our first quiz so we can warm up with a little quiz.
Yeah, I was gonna say, are you all ready for the first quiz of tonight? As a reminder, you can put in the comments on YouTube. Just click the YouTube link if you're not watching directly on YouTube. So put your comments, your answers in the comments, and let's start. So, on average, how long does it take for a patient with symptoms of an autoimmune disease to receive an accurate diagnosis in the United States? A, 6 months, B, 1 year, C, 2 to 3 years, or D, 4 to 5 years. And we'll give you all a few seconds. Remember, we're asking on average, how long does it take for a patient with symptoms of autoimmune disease to receive an accurate diagnosis? And the answer is D. Unfortunately, research has shown that it often takes an average of 4 to 5 years and several visits to multiple providers before patients with an autoimmune disease receive a correct diagnosis. Now, this delay is due to a couple of factors. It's attributed to non-specific early symptoms. So, of course, we all know that patients with autoimmune disease can present with an array of symptoms, and so figuring out what's going on can take a little bit of time. Um, Several autoimmune conditions have symptoms that overlap with each other, so we have to tease out which disease is causing the symptoms, and then, of course, limited screening tools and lack of awareness among providers. Now, what's great is that as functional medicine practitioners, we are uniquely poised to support these patients because, of course, we have access to evidence based strategies, resources that actually help get to the root cause of their immune system dysregulation and why they develop this immune or autoimmune disease in the first place. So I think this is a great segue into Dr. Tall walking us through what immune dysregulation is and how it actually causes autoimmunity.
Yes. So there's a lot that we we cover when we talk about functional immunology, right? Which is sort of the science of um, how how different factors impact our immune system, right? And it's all comes from the initial thought of or concept that most of our patients were not born with those chronic autoimmune conditions, right? So going back to the time where they even remember that they had their immune system was normal and functioning in a healthy state, right? But then something happened along that timeline. Something happened that kind of shifted things, and now this let's say this switch on the wall has been turned on, right? And they just can't shut it off. So I'm so glad that you mentioned this quiz, because it's really a part of like how long did it take for them to be diagnosed, right? And how long would it take for them until we've seen so many patients in practice where they're coming in, and they tried this medication for a period of time, and then they tried a different medication, and they try a different medication. And by the time they see us, it's like 5, 10, 15 years into the disease. And there's a lot of suffering, a lot of struggle. We've also seen a lot of folks in disability by the time they come to see us. Mm-hmm. So this is where functional medicine, we take a different approach. And we understand that when we talk about immune dysregulation, it really refers to the ability of the immune systems to maintain tolerance, right? Tolerance towards self, right? While having an appropriate response or a different response to threats such as viruses or bacteria. So in a healthy immune system, essentially, we have the drivers of inflammation, right? Let's call them different cytokines like interleukin-6 and tumor necrosis factor alpha. And then on the other hand, we have those cells that are the brakes, right? That are telling our immune system, let's stop, let's not continue any further, right? So imagine it's kind of like you have the army soldiers or the police, and there's violent people, and they're going after the violent people, right? They're protecting the borders, right? Whatever it is. And now there's essentially what will happen, there's a dysregulation, and the military is now starting to attack in the cities, right? So it's essentially a problem that we have lost the brakes, right? The car is driving, but we lost the ability to press the brakes. And those brakes, the cells that pushes the brakes there's different cells. There's interleukin-10, which is a very well-known cytokine. There's also regulatory T cells, which we call them Tregs, right? So there's different cells that their job is to keep things, to kind of slow down that inflammation. So let's take a look at this really interesting study. This is an article published in Journal of Natural Medicines, and really highlights the different factors that can contribute to this development. And as I mentioned previously, in functional medicine, we're always thinking about, right, instead of just managing the condition, right? Which, by the way, this is what we call the integrative management, right? Integrative management could include a prescription of a drug, like a steroid, or it could also include herbal medicine. There are specific herbal medicine, clinical nutritional protocols for specific conditions, right? But here we're talking about diving deeper to more of a level of the root cause, or some people call it corrective care, right? So really understanding what's going on that triggers that. So we have on the left side the genetic susceptibility, and we have the effect on antigen presentation or recognition, and then changes in responses to the tissue. On the right side, we have the impact of the environment, antigen-specific cross-reactivity, and tissue-restrict effect, right? So this is really a classical example of how we have the genetic predisposition in the way that our body handled itself or keeps the homeostasis. And then we also have these different factors, right? So we have, in functional immunology, we dive deeper into how does our diet, things that we eat, right? Sometimes things that are even considered healthy, right, could shift the immune pathway, right? We look at lifestyle factor, we look at environmental factors, things that are in our environment, at home, in our office, wherever it is. We look at all the different factors that can impact, right? Typically, there's like 6 or 7 different root causes that can cause autoimmunity. So this is really a big part of start asking yourself when you see a patient with autoimmune condition, what happened that triggered that? Sometimes it's a good question to also ask the patient, like when the symptoms started or just before that, what happened? What happened in your life? Did you change? Did you move to a different house? Did you start a new job? Did you had anything traumatic happen to you? We want to start asking questions, start thinking like a functional medicine detective, right? What might have led to the development of this dysregulation and the loss of the brakes in the car, right? Now the car just keeps on going and going and going. That's the the analogy of the immune system that just keeps on going and attacking and attacking and attacking, right? Even innocent cells get attacked. So that's a really big part of it. So let's take a look at some at an interesting quiz, which is essentially the contributing factors to immune dysregulation, right? So I'll give you a few options here. So which of the following factors can contribute to immune dysregulation and increase the risk of developing autoimmunity? So just from what we have talked so far, and maybe you can also guesstimate, option number 1 is genetic susceptibility and impaired regulation. Option number 2, or B, that's environmental triggers such as infection, toxins, or chronic stress. Option number 3, or C, that's gut dysbiosis and increased intestinal permeability. And option number D is all the above. Which one do you think is most important contributor or most known contributor to immune dysregulation? You can put it in the chat. I'll give you a few seconds. Okay, so if you said all of the above, you are absolutely correct. We mentioned that genetic susceptibility and environmental triggers could lead to, they can contribute to the development of those diseases. And our next step is going to talk about gut dysbiosis, right? So the gut plays a very, very important role in the development of autoimmune conditions. And unfortunately, what you are going to learn now from Dr. Sarah is not covered, is not taught in most medical or most nursing schools. And we know that because the number one thing that most practitioners are telling us when they're in our advanced and clinical functional medicine program is, I wish I would have learned this in medical school, right? I wish I would have learned this 20 years ago. I wish I would have learned this 10 years ago because it could have helped so many more patients, right? Or helped them on a much deeper level in starting to resolve the root causes instead of focusing just on the symptoms, right? Or the management of the condition, right? So Dr. Sarah, take us into what is the sort of like an overview of what's the normal process of inflammation, and then we can go into the gut to kind of start talking about more about the gut health and what do we need to do from there.
Absolutely. Yeah, before we start talking about the gut and its role in altering the immune system and how it works, we should figure out how inflammation works in the first place. So I'll be sharing a couple of moving pieces. So let's start with an image. This is an image from a 2012 literature review study in the Journal of Critical Reviews in Biomedical Engineering. And I love this schematic because it does a really beautiful job of highlighting the process of inflammation. Now, of course, as functional medicine providers, we're always looking at, sources of chronic inflammation because that's really where the problems begin. But inflammation is a beautifully, tightly regulated, essential component of healing. It's the way in which our body restores our damaged tissues and kind of brings us back to homeostasis. So on the left here, we have the section that says inducers. So these are things that are going to stimulate that inflammatory process. This can either be done through infection. So if someone has an infection of some sort, that is going to activate the innate immune system or immune response, our first line of defense, or even tissue damage. You'd say you get a paper cut, or a patient has some sort of tissue damage in their body. Whenever the tissue is injured or a pathogen is identified or detected, there are certain molecules called pattern recognition receptors on our immune cells, almost like a satellite where they're picking up different signals. And that actually initiates a cascade of different cytokines or messaging molecules that recruit. So these immune cells pretty much release these signals, and it wakes up the rest of the immune system to say, it's a 5 alarm fire. Please bring all resources we need to take care of this issue. Now, these inflammatory cytokines, they are pro-inflammatory. So Dr. Tall mentioned like IL-10, is an interleukin 10. It's another cytokine that's actually anti-inflammatory. But in this process, they're releasing pro-inflammatory cytokines like interleukin 1 beta, and one that we talk about all the time, TNF alpha. Of course, with other compounds like chemokines and prostaglandins, these are all signals to just rally the troops to help support the innate immune system. Now, this is going to lead to, and those sort of cells, those are called the sensors. So as we look here on the image, as we move towards the left, these sensors have those pattern recognition receptors, and they release those cytokines or the mediators. We have a few here listed. So TNF alpha, interleukin 1, interleukin 6, which plays a key role in gut inflammation and gut dysbiosis, as well as histamine. Histamine is released by our immune system, and I'm sure, as you've seen in clinic, there's so many patients that present with histamine intolerance, which is directly tied to immune activation, as well as eicosanoids. So what happens when this damage or infection is detected? The sensor immune cells have released those signals to recruit more immune activity. So what tends to happen? Well, those cytokines actually impact tissues throughout the body. So they can impact the liver, the colon, and as well as our cardiovascular system. Now, these cells, these sensors, and this kind of whole process is designed to neutralize the threat, clear any cellular debris, particularly those damaged cells that have died or are beyond repair. And then they initiate repair to bring us back to homeostasis. Now, under normal circumstances, this is just acute inflammation after an acute infection or injury. The issue is when the immune system does not return back to baseline. And instead, that inflammatory process continues on. And that is due to a lack of those cells that Dr. Tall talked about a little bit, those Treg cells, those regulatory T cells. I like to call them the fire extinguishers of the immune system. So after, like you see here in the picture, after the mast cells release their histamine and the dendritic cells and macrophages release those cytokines, the T regulatory cells come in and just cool off that flame. Like, okay, guys, thank you. The fire is taken care of. Let's get back to just bringing us back into a healthy baseline. The challenge that we see with autoimmune patients is that this inflammatory pathway becomes dysregulated, whether it's due to genetic predispositions, gut dysbiosis, which we'll talk about shortly, but there's something in the patient that is causing this normal, healthy inflammatory pathway to not be turned off, or to be super sensitive and to react to things that are actually our own cells or our own tissues, or things that shouldn't warrant that sort of reaction. Now, that's imbalance really leads to unchecked activation of certain T cells, particularly effector T cells. And it leads to the activation of more pro-inflammatory cytokines. So if we look at another image from this is from a 2024 article in the International Journal of Molecular Sciences. I really love this picture because this is taking us down to the cellular level to show what happens during the inflammatory process. So let's start on the left. And we see here this sort of graph on the y-axis. We see the disease severity. So at the bottom, it's subclinical. This is usually where patients are not feeling well, but they're not sick enough to really justify a full workup. If they did do a workup, their numbers would probably be a bit borderline. And then as we go further up the y-axis, that's where we enter clinical disease. And then on the x-axis is time. So the time to which the condition starts from not being present, subclinical, and into clinical disease. So early on in the disease process, we have initiation. So this is where the patient had already may be presenting with a genetic predisposition. They have a family history of autoimmune disease, or even they're exposed to environmental triggers that make their immune system hypersensitive. Over time, they transition into propagation. This is a frame where the cytokines are being excreted. We see Treg cells and T effector cells. The balance between the effector cells and the regulatory cells become imbalanced. And if we follow this beautiful kind of purple and teal arrow, we can see the changes that are happening on a cellular level. So we have that environmental stimuli that activates these immune cells. It activates the T cells as well as B cells. And then we begin to see the development of tissue injury. Now, I want to slide over to the left where you see self-tolerance failure. So in a normal patient, they're going to have this environmental stimuli. They're going to activate the immune cells, but the immune cells are going to respond normally. But if a patient has a genetic predisposition, they're going to be less tolerant of their own cells. And this is where we begin to see what we call autoreactive cells. So these cells that recognize our own tissue and begin to replicate so that they begin to attack our own tissues. In some cases, they can even impact the activity of T regulatory cells. And so as we go on throughout the clinical progress, we go into resolution. So ideally, we should be able to bring down that inflammatory process and inflammatory action and be able to restore a healthy immune balance. So I really love this image because it's showing us the way in which the immune system becomes active or initiated, the way that the T and B cells begin to expand. And if we have lost self-tolerance or being able to tolerate and not attack our own cells, then we begin to see some of the classic clinical symptoms due to that tissue damage and tissue injury. So Dr. Tall, let's get ready for our third quiz question. Excuse me. I know we covered quite a bit with regard to functional immunology during this past section, but given that we just covered it, I think you all will be pretty prepared for this quiz.
Mm-hmm. Yes, so let's go into the quiz. So this would be quiz number 3, immune regulation and autoimmunity. So what are the most likely consequences of deficiency in regulatory T cells or Tregs or the anti-inflammatory cytokine interleukin-10? So option number 1 is enhanced tolerance to self-antigen and reduce risk of autoimmunity. B, increased suppression of effector T cells responses leading to immunodeficiency. C, loss of immune regulation, increased pro-inflammatory signals and greater risk of autoimmune tissue damage. D is overactivation of B cells, resulting in excessive antibodies production against pathogens only. So again, what is the most likely consequences of deficiency if your patient does not have enough Tregs or the IL-10 cytokine? What would that lead to, right? And you can put it in the chat. This is a little bit of a challenging question, but just to kind of tickle our brain a little bit. And so I'll give you a few seconds. Okay, so the most likely consequence of deficiency, if your patient have deficiency in Tregs or the anti-inflammatory cytokine interleukin-10, is the loss of immune regulation and an increase in pro-inflammatory signals, right? So we mentioned those two are, and of course we're oversimplifying this whole thing, this whole process, but this is a part of our the brakes, the mechanisms that stops that excess inflammation, right? Now, the reason why we talk so much about inflammation, and this is just really as a general comment, right? The reason we talk about so much about inflammation is because inflammation is one big component in developing this autoimmune condition and most chronic conditions, by the way. So we have the genetic component, we have what triggers the genetic component, which is our environment, our lifestyle, diet, and of course inflammation. And of course, the reason why we're now talking about the environment and lifestyle and diet, because all of them can drive inflammation, right? There's probably 6 or 7 different factors that can drive inflammation. Interestingly, when we talk about inflammation can contribute to almost any chronic condition. So, interesting conversation that I had just this week with a nurse practitioner that's working in the cardiac unit, and she said she's interested in learning functional medicine because, she's seeing all these patients coming into the hospital. They're suffering. They're going into the ICU. They have all these cardiovascular issues, and there's a lot of work on patching them up so we can send them home, right? Stabilizing them, patching them up, and I asked her, so what made you interested in functional medicine? She said, well, we don't really address what's causing their cardiovascular conditions, right? I mean, we sort of know that it's inflammation plays a role in it, but what else do we do, right? So it's really interesting how when you look at the clinical studies, we now understand that inflammation plays a major role in all the different conditions, not just cardiovascular or metabolic, but also, for example, endocrine or degenerative conditions, or even neurological and even cancer. So there was an interesting study that was done. It was published in 2012. It's called in the journal The Lancet Oncology, and this was an interesting study. It was done in a hospital in England. And what they found was very, very interesting. They followed individuals who were taking anti-inflammatory drugs. And they found from 1950 to 2011, right, so 61 years, they found that patients that were taking anti-inflammatory drugs had statistically significant lower incidence of death from cancers, right? So really interesting on how some of these studies already came out over a decade ago, showing us that inflammation is a major disruptor of health and wellness. And if we don't address the root cause, if you don't learn how to address the root cause, then it's really hard to help those patients in the long term. So let's go into one of the major factors, and which is how do we use probiotics? And in order to understand how do we use probiotics for autoimmune patients, right, we have to understand how it works. So Dr. Ellis, take us into how does the how does how does probiotic work? What are some of the interesting mechanisms that through changing our gut we can also change our the autoimmunity, the process of autoimmunity. So,
Yeah, awesome. I'm so glad to talk about it. Probiotics are, they actually have like criteria of what is considered a probiotic. So it has to be a live bacteria. There are a couple of criteria, but the main one is they have to provide a health benefit. So when you are taking a probiotic, does it actually provide a benefit for you? And researchers have studied so many different strains, and thankfully, there are a number of studies that have connected different strains of bacteria, whether it's lactobacillus strains, bifidobacterium, or even some of the bacillus spores. They've discussed how probiotics can prevent and even manage a variety of human diseases. So let's take a look at this image from a chapter in the 2021 edition of the textbook Probiotics in the Prevention and Management of Human Diseases. So this picture might have a little bit going on, but I'm going to guide you through it. Let's start at the top. And actually, before we start going through this image, I wanted to kind of make sure we're all on the same field or baseline of knowledge. And so we all know that, the gut is central to immune system regulation. In fact, nearly 70% of the immune system resides, in the gut associated lymphoid tissue, or the GALT. And that is where our microbiome actually trains our immune system to teach it between and help it identify friend versus foe. And so this is one of the reasons why when you're talking to new moms and pregnant women, and thinking about, delivery, this is why, a vaginal birth is so important compared to a C-section. Of course, C-sections are very important in certain situations, but when a baby is able to be exposed to mom's microbiome, its immune system gets to be trained and help identify a friend versus foe, and they're a little bit less likely to have a hypersensitive immune system. And that's because a healthy, diverse microbiome helps promote healthy levels of those Treg cells, those fire extinguishers. And by having healthy levels of Treg cells, we're going to have healthy levels of the anti-inflammatory cytokine IL-10. So having a healthy and diverse microbiome is critical for having those breaks that Dr. Tall talked about in the inflammatory process. So let's take a look at this image. Above on the top left, where we see probiotic treatment, this is where we're introducing probiotics to our patient, whether it's lactobacillus strains, bifido, or bacillus. And these are important because these bacteria make a host of different compounds, or even what we call postbiotics. They make bacteriocins. These are antibacterial compounds. So remember, bacteria, they compete with each other. They don't want to have to share their resources with a ton of different other bacteria. So they're going to release bacteriocins to kill off some of the competition and reserve some of the fuel and nutrition for themselves. They make lactic acid, and lactic acid helps keep the pH nice and low, because we know that our healthy commensals prefer to live in a lower pH, more acidic environment. And so supplementing with bacteria like lactobacillus and bifido, they make lactic acid, which keeps that pH nice and healthy. Now, of course, they also can make prostaglandins. And so having these bacteriocins and lactic acid helps reduce gut dysbiosis, because it's going to make the environment less hospitable to the bad guys. And then they're also going to make prostaglandins to help reduce any inflammation present in the gut. And they could also make a couple of other compounds, short chain fatty acids and retinoic acid, all designed to help improve gut integrity. Remember, we're trying to keep that gut barrier nice and strong. Now, this is what we see in a healthy person. As a matter of fact, this schematic is looking at specifically how joint inflammation is mediated by gut health or the presence of gut dysbiosis. So on the left, we are looking at the healthy, natural sort of benefits that we see from probiotic treatment. We're going to see that it blocks that inflammatory pathway that's driven by nuclear factor kappa beta, as well as a healthy balance between the Th1 and T helper 1 and T helper 2 cells and the T regulatory cells. So in a healthy joint, we see a nice healthy balance. We see a strong gut barrier, as well as like I said, a good balance between the inflammatory T helper cells and anti-inflammatory regulatory T cells. Now let's look at what happens with a patient with rheumatoid arthritis on the right. When a patient is presenting with rheumatoid arthritis, they tend to have environmental factors that are one of the root causes. They may have a genetic predisposition, and they usually tend to also have gut dysbiosis. So this is going to lead to inflammation present in the gut. And then with inflammation present, particularly due to inflammatory types of bacteria that have endotoxins like lipopolysaccharide, that is going to lead to a loss of gut barrier integrity. So we can see these line of colon cells. They're not as tight. Those tight junctions have actually loosened up quite a bit. And so that leads to the development of leaky gut and sets the stage for autoimmunity. And that's because we see so many different dysregulation as it comes to the innate cells. So the innate immune system, when it's dysregulated, we have the natural killer cells and dendritic cells that tend to or can attack our tissues. Some of these T cells, the CD4 and CD8 cells, they're the ones that are going to release those inflammatory cytokines. And then the B cells are going to release those auto antibodies. And so that's going to lead to joint inflammation, joint pain, swelling, and disability, unfortunately. And so this schematic is one of the best ways to highlight why probiotics are so important. Now, I wanted to make sure I explain that the probiotics are changing the landscape of the gut. And as Dr. Tall and I have said on the show several times in past episodes, it's not just enough to give them the probiotics. We want to support diet and other supplements to help feed the good bacteria as well. And so let's transition into our final quiz of the evening. Which of the following are mechanisms by which probiotics may benefit individuals with autoimmune disease? So how exactly do probiotics benefit people with autoimmune disease? Number one, or option A, probiotics promote regulatory T cells. Option B, probiotics increase anti-inflammatory cytokines like IL-10 and TGF-beta. Probiotics suppress pro-inflammatory cytokines such as TNF-alpha and interleukin-6. Option D, probiotics enhance gut barrier integrity and modulates microbiota composition. Or E, all of the above. We'll give you all just a few moments to put in your answers in the chat. And the answer is E, all of the above. Probiotics, as we saw in the previous image, they promote the establishment and differentiation of regulatory T cells. They increase those inflammatory cytokines. They suppress and reduce the pro-inflammatory cytokines, and they change the gut microbiome in a way that supports health, supports gut barrier integrity, and helps reduce inflammation. So, Dr. Tall, when you think of using probiotics with autoimmune patients, like what's the first thing that you think of?
Yeah, so the first thing that I obviously always think about is on the most simplified level of helping the patient better manage their condition, we can think about probiotics, right? So that's one example, and we actually have an example, a really good example of a probiotic specific strain of probiotic and a product as an example for everybody who's watching tonight, and it's the simplest way, right? I call it integrative management, because when you give a prescription or a patient comes to see you, can say, oh, by the way, we also have this, there's also this particular species of probiotic that was found to be helpful with autoimmune conditions. And it's as simple as adding another pill, right? So the integrative approach, integrative management, doesn't really require the patient a significant investment of time or money or effort. It's just as simple, right? They're already taking a few pills. Here's another 1 or 2 supplements. And we found out, I would say almost all patients that we have talked to are very open to it, because it's simple, right? It's simple to apply. You can even do it on a primary care 7 to 10 minutes visit, or 5 to 10 minutes. It's like as simple as here's another strategy, or here's 2 more strategies or supplements, right? One thing that I wanted to mention, so there's 2 things, right? One is we want to use evidence-based approach, the particular strain. That's always important, right? You don't want to just randomly take a bunch of different species, because as we already know, each species of probiotic has certain things that they do and certain things they don't, right? The second thing that I wanted to mention is that when we start diving deeper into understanding our patients, right, and this is going a little bit deeper into the functional or root cause kind of level, right, it's one of the things that it's really important is to really learn the mechanism and identify the symptoms and signs. So as you have a conversation with your patient about their diet, lifestyle, GI symptoms, whatever it is, you can start to pick up on these things, right? And when you order a functional medicine lab, the really cool things about functional medicine lab, this is why a lot of practitioners love using functional medicine labs. Like most practitioners that we have trained, and we got over 200 new practitioners practitioners that are coming in into the advanced and clinical functional medicine program every year. So one of the cool things that we see is that once practitioners go into the functional labs and they learn the mechanisms, it's really hard to go back, because now you see it all right there in front of you. You see all the data. So when you order, I wanted to mention where you can order those labs. Genova Diagnostics is one specialty lab. The lab is called GI Effect. And then there's another one that is another specialty lab that is called Doctor's Data. And they have a lab called GI 360. When you get those labs, obviously you're going to get like 4 or 5 different pages of data. But each one of those data points is so critical, because it gives us so much information in terms of, and a lot of practitioners thinks that GI analysis is actually for gut, right? So yes, GI analysis tests the gut ecosystem, right? Because it's a stool sample. But it also contains data about so many different metabolites, right? And it also tells us which are of the good bacteria we have and which of the bad or imbalanced bacteria we have, what's the impact on the immune system. And so here's one example. When we look, one of the results what we get from those tests is the levels of short-chain fatty acids. And Dr. Alice, you mentioned short-chain fatty acid has an important role. We're not going to get into it too much, because it's a whole long training about just diving into the gut function, integrity, and ecosystem. But short-chain fatty acids, when your patient does not produce enough short-chain fatty acids in their gut bacteria and the gut ecosystem, there could be different reasons for that. But if they don't produce enough short-chain fatty acids, essentially it's harder to tame down the inflammation, because what short-chain fatty acid does, it shuts down and inhibit several inflammatory pathways. And we used to think that, oh, that only impacts our gut. But now there's new studies that are actually showing us that short-chain fatty acid slip from our gut into the bloodstream, and they just travel into different tissues and different organs in our body, and slowly kind of inhibiting and shutting down inflammatory processes, right, from growing or flaring up, right? There's also a study that reported that short-chain fatty acids are nature's anti-inflammatory compounds that actually cross the blood-brain barrier, right? That's for a whole different conversation, right? But we now understand that there's, and we dive more into it. So if you are interested, learning more about the impact of the gut on the brain conditions, cognitive, neurological, there's a specific class we have on a gut-brain axis. There's a specific class that we have on a gut cardiovascular axis. We learn about the impact on different autoimmune conditions. But this is really the cool part about why we're so excited about this data and new clinical studies, because now it's showing us that there are ways there are different tools we can use to start shutting down and turning down all those inflammatory pathways, right, from the inside out, instead of trying to mask or mitigate the whole entire immune system, right? So let's dive into one practical example of how would that look like on a most basic, essential, and simple level. And this is a specific strain of probiotics. So this is called the Bifidobacterium longum 35624. And it's one of the most studies and research probiotic strain in the market. Had multiple studies in the last 20 years. And there's a really interesting study, particularly a study that was done on this strain of probiotics, beneficial bacteria in 2013. As Danish researchers conducted a clinical study to assess its ability to induce immunomodulation, right? So essentially modulate or regulate the dysfunctional immune response, right? And this was done with patients with irritable bowel syndrome or IBS. And what they did, it was an interesting study. It was a randomized double blind. So there was a group that received a placebo, and they essentially got the treatment group received daily supplementation for 2 months with this particular strain of probiotic, and they measured systemic and cellular markers of immune function. And what they found after 2 months, so again, really simple strategy, right? Like 1 tablet a day, and with that specific strain of probiotic. What they found is 2 months later, there was a significant reduction in pro-inflammatory cytokines in the major one, like interleukin-6 and tumor necrosis factor alpha, interferon gamma. And there was also an increase of the anti-inflammatory interleukin cytokines like interleukin-10. So some participant even had a reduction in C-reactive protein. So really cool stuff and really amazing results for just this one simple strategy. And this is where we always tell practitioners when we're going through our program, right? In phase 1 of the advanced functional medicine program, you're really going to learn about all the different root causes, right? You're going to learn about and we'll post a citation here so you can take down write down the name of this product. So the product is called Align Probiotic, and that has, again, the specific strain of this probiotic, the Bifidobacterium longum 35624. Let's zoom on me, and then we'll put on back the citation for that study, so you can find that study if you want to read more about it. It was published in the Gut Microbes, the Journal of Gut Microbes, in 2013. But here's the interesting part is that we always tell practitioners, we go through the program. Phase 1 is really focused on understanding the root causes, right? So we go into the gut, the environment, from systems, right? Diet, lifestyle, from systems, all the way down, like the endocrine shifts and all that stuff, all the way down to the level of the cell, like literally what's happening in the cell, what dysregulation happened in the cell that kind of causes that inflammation. And here's the citation, by the way, if you want to read more about this particular strain of probiotic, here's the citation. So in the program, as we go back to learning functional medicine, in the program, the Advanced in Clinical Functional Medicine, we really dive in a certain way. So we go into the root causes, right? And we teach you the labs, the evaluation, the treatment protocols, and then you already know you can complete it within it's self-paced. So you can complete it within probably 2 to 4 months. And you also assign a mentor, and they work with you like a functional medicine physician who works with you on case studies and really kind of build that functional medicine muscle, right? From there, you already know the entire system. So you can now consult patients, you can use the lab testing, you can help those patients who have been struggling with chronic conditions. In phase 2, we dive deeper into the integrative and functional approach, where we go more specifically into each autoimmune condition. And we learned specific protocols like this one, for example, the Phytobacterium longum, right? So, but we talk about specific protocols for each condition. So patient comes to see you with rheumatoid arthritis. What are the top 3 or 4 different protocols you can use? Nutritional protocols, herbal protocols, different evidence-based strategies. Right? If you're seeing more of a cardiovascular, we have a specific class on that. If you're seeing geriatric or neurological, you're seeing chronic pain, maybe women's health condition, right? We got you covered. We also go into genetic. We also go into understanding what type of deficiencies drugs might cause, right? Many of our patients are on drugs, which can cause nutritional deficiencies. So what does that do to our body? How we can compensate and support our patients better. So by the time you complete the training, you already have so much clinical knowledge, right? And understanding about the root cause. When a patient comes to see you, you can offer them all 3 levels of care, right? From integrative management, which is here's our natural strategies or a drug, right? Or both to get better clinical results. That's simple. It takes like just a few minutes, right? If you want to dive deeper, let's do proactive wellness, which is the diet or lifestyle changes. We teach you strategies specific for each condition as well. And then the deeper level is really, as a provider, you understand now the root causes. So those are all the different approach that the academy takes, and why our graduates are so successful, from nurses to physicians, PAs, pharmacists. They're very successful in their practices. And if you're interested in more information, reach out to us. We got an amazing program. You can reach out to us if you got more questions, if this is the right thing for you, or if you want to ask more about how it works and what's included. We'll be happy to share that with you. And then on Saturday, I'm also doing a specific training, taking you through the 3 levels of care. It's going to be Saturday morning or sort of late morning in the East Coast, but that's going to be really diving into treating metabolic and type 2 diabetes through the lens of the 3 levels of care: the integrative management, the proactive wellness, and the root cause. So if you're interested in that, learning more about that, join me for an hour on Saturday morning, and I'll show you. I have clinical examples exactly how to do that. So I feel like we covered a lot, Dr. Ellis. I know that we talked a lot about inflammation. We talked about the autoimmunity. We talked about the gut in healthy state and dysbiotic or dysregulated state, and also give a really good example for how to, in a simple way, any practitioner can make additional recommendation that reduces inflammatory pathways, some inflammatory pathways or inflammatory cytokines. So, we didn't have time to go into the lab testing and all of that. I know we do that a lot more in the advanced training, and also in the coaching calls, right? So when they go up with you for a coaching call and they bring a case study, you're there to support them And we also have Dr. Chill, who's got lots years of experience. So we are here for you. You're never by yourself. We're here to support you. And this was really a class that Dr. Ellis has prepared for us for kind of getting a better understanding of how does probiotic work for autoimmune condition. Like what's the connection there, right? And we know now, if you just take one thing out of this session, is remember that these root causes, like what happens in our gut, doesn't just stay in our gut. It can impact almost every part of our body. So with that being said, I know we're a little bit over time. So any kind of remarking conclusions or anything that you wanted to add, Dr. Alice, to that?
Yeah, I know we covered so much material tonight, but it was so helpful. I hope that you all feel a bit better prepared to help support your autoimmune patients, especially understanding how gut health and probiotics tie in. And you mentioned labs. So, if you have a patient in mind and you ran a stool test on them, now you have a new set of fresh eyes to review that stool test to give you a bit more information as it pertains to what's going on with the patient's immune system and their gut. So I hope you all enjoyed our chat tonight. I know I did.
Yes, absolutely. It was a lot of fun. And as you're watching this, if you're in our program, then in our advanced program, right, we have different programs in the academy, but if you're in the advanced program, log in, and the entire gut root cause analysis and labs, and we do a deep dive into each one of those biomarkers, so you can better identify what's wrong with your patients. But we have that in the first few classes, first few modules. So log in, continue to dive deeper into these. And of course, you're welcome to schedule a coaching call, one-on-one coaching call. Some practitioners have been doing the coaching calls for themselves. So you might be able to even order the lab for yourself, or family member or a friend that needs help to better understand what's going on there, or a real patient, right? If you got a patient that has been struggling, then you can reach out to us. The coaching calls are open to everybody, everybody in our advanced program. It doesn't cost you anything. It's available to you. And then we're very excited about the phone app that is coming up. So everybody that is enrolling this month is getting the phone app, the Functional Medicine phone app. This is the best clinical tool that any practitioners can ask for when they integrate functional and integrative approach, because all you got to do is just type in the condition, like in typing type 2 diabetes or arthritis or lupus or whatever it is, and it pulls all the treatment strategies in like a second, and then it's connected to PubMed, and it gives you the dosages, which product you can find it, right? So you're not looking around, you're like, well, what else can I do for this patient, right? It's all right there. So that's coming up. So when you enroll, practitioners are enrolling this month will also get access to that as a bonus. So yeah, if you got any other questions about our advanced certification program, reach out to us. This month is a really special month and great time to look into it. So thank you so much for being here. Thank you, Dr. Ellis, for preparing and sharing your experience with this. I also want to thank our media team and Jacob, who produced this discussion and made this all possible for us. So thank you, our team, from running everything behind the scenes. And as usual, I appreciate each one of you for being there for your patients every day and being committed to helping your patients, your community. So take care in the meantime, and have a good evening.
Have a good evening, everyone. Bye-bye.